Hi, it's Jenny D and Health Tidbits with Dr. Kohli, 9 News medical expert, Harvard educated, an associate professor. Wow, it's been a day, right? Oh, man. But also Cherry Creek Heart in Aurora. That is her practice. Today, let's talk about new medication for hidden cholesterol. This just came out recently.
Just came out 2 days ago, hot off the press at the American College of Cardiology meeting. And here's what's tricky about this cholesterol. It doesn't show up on a regular blood test.
Oh,
So if you get your cholesterol panel checked once a year with your physical, this cholesterol doesn't show up. It's called lipoprotein A.
Okay.
And 20% of us are walking around with the lipoprotein A target sign, I call it. It's super high levels that are going to make us have a heart attack, a stroke, plug up our heart valves. And this cholesterol doesn't just cause problems in the arteries and cause plaque. It actually causes blood clots, and it actually causes valve blockages. So it's a really, really, really scary cholesterol that we've just recently sort of stumbled upon in the medical community as being causal in all these bad things.
Okay.
And most doctors, by the way, out there don't regularly check this. So it's not something that your doctor might even think to check.
Okay.
And the Wall Street Journal did a really nice article about some tests that your doctor never thinks to check, and this is one of them. So I want every single person to write down lipoprotein A because it is something you should get checked at least once. Now, it's largely genetically determined, so it means you don't have to keep checking it over and over again.
Okay.
It's about 70 to 90% genetically determined, doesn't really vary much based on diet or exercise or any of those other types of factors.
Okay.
So you check it once. If it's low, you're done. If it's high, it actually creates a lot of implications for your family members and for your risk.
Yeah. Well, and we have heart disease in our family.
Do you?
My
so
dad.
that's a good indication that you should get yours checked.
Yeah.
Yeah.
Okay.
Yeah.
I've never heard of it. That's why, obviously I'm not a doctor, but yeah. But I love this. So is there certain races or people that are more susceptible to it? Because you said it's hereditary.
Yeah.
Mostly.
So there are. So Africans usually have a very high level. South Asians like myself can also have very high levels. So there was some question about whether we should be using race-specific cutoffs. Like, should every race be counted by the same cutoff? But they realized that it's actually just so scary that, yes, every race should be counted with the same cutoff. So you don't say, okay, because you're African, we'll let you be higher. It's still very high. Now, how high it is also affects your risk. So if it's just a teensy bit above the cutoff, which is 75 is the number, nanomoles per liter to put into your head. So if you're at 76, your risk is a little high. But I have patients in my practice at 300, 400, 500. So now you're talking about that target sign being gigantic on this person. And
and think about the sample size right now, because this is something that's so new. They might not know as much as they will, say, in a year when they're actually doing these tests more often.
That's exactly right. And so you really have to be proactive, Jenny. Ask your doctor for this test, because a lot of primary care doctors haven't even heard of it, or they don't think, oh, well, we don't have treatments for it. We can talk about that in a second. So what am I going to do with it? But in my practice, I'm checking it on every single patient that walks through the door, because like I said, 1 out of 5, 20% elevated.
Yes.
And then if I find a positive person, I check their kids, I check their siblings, I check their parents, and all of a sudden now I've created impact in the entire family by checking this test. And I manage their other risk factors more aggressively, the ones that I do have control over right now. And what I'm really excited about, based on this heart meeting, is that there's actually a new drug coming that reduces the levels of this bad guy by over 90%.
That's awesome.
And it's one injection, and it lasts for 6 months.
Okay.
And so it's not even a pill that you have to take every day. So even though today those drugs not approved, they're just around the corner. And lining people up to know whose levels are elevated is the right thing to do, so that we can start to give them that medicine when it comes out.
Okay. So as for right now, it's more monitoring.
It's
and
monitoring
helping
and
manage
changing
the
your
other
risk.
ones.
Right, exactly. So if I find it positive in you today, I might start you on an aspirin. If it's positive in you, you're more likely to have a pregnancy complication if you're a young woman about to get pregnant.
Yeah.
So your OB might put you on an aspirin. We might manage your other cholesterol, called the LDL cholesterol, a little bit more aggressively. So there's lots of other things I can do right now. But because the medicines to actually target this are just around the corner, that's another reason to check. And we just had on March 24th Lipoprotein Awareness Day.
Oh, okay.
Which is a Family Heart Foundation initiative to really try to raise awareness of this, because it is this hidden danger that so many of us have that we just don't think about.
Well, and if you're looking for a doctor, Cherry Creek Heart in Aurora, Dr. Kohli, you'll see her as well on 9 News. But thank you. And
thank you.
Yeah,
and you're going to get yours checked, right?
Yes, I'm going to get my I'll come into your office. I'll come into your office.
Love that.